Alright, hello everybody. So I'm here talking to you guys about spinal cord injuries. So, what it is, spinal cord injuries can kind of result from a loss of somatic sensory, autonomic functions, all below that respective liaison. So in the cervical region, it can actually result in replasia or jugular paralysis. But then there's also your thoracic, lumbar, and sacral regions, which can lead to paraplegia or paralysis. So, some exercise testing considerations. So, when getting started, one should assess the function along with the range of motion, strength, balance, transferability, wheelchair mobility, along with upper and lower extremity motor involvement. Also considering the purpose and the reasoning for the exercise test that you're using. Um, Choosing the exercises that will also allow for the most engagement of the largest possible muscle masses. Um, Along with, after maximal exercises, those who have paraplegia might be needed to treat for hypotension, exhaustion, with rest, leg elevation, and fluid ingestion. There is no special consideration for the muscular strength assessment besides the testing mode taking place with the exception of the liaison level. So those who require a wheelchair also may develop a joint contractures. So this can be due to muscles spasticity along with strength imbalances and or flex joint position in the wheelchair. Um, so the fit recommendations. Um, so for the aerobic, the frequency, a minimum of 2 days a week getting started and then progressing to 3 days a week. And then those athletes, those can increase with the progression to 3 to 5 days a week. The intensity, beginners, moderate intensity, usually working 40 to 59% of their heart rate reserve, where those athletes working a little bit higher at 75 to 90. Time, initially bouts from 5 to 10 minutes, alternating with 5 minutes with 5 minutes of active recovery periods, and then gradually increasing that time for 20 minutes per session, along with decreasing those rest periods. And then type, engaging all the largest possible muscle masses, using different ergometries, rowings or rollers for this. And then for the resistance, frequency, at least a minimum of 2 days a week. Intensity, initially using 20 RMs for each of the exercises. And then time, initially starting off with 1 to 2 sets of each exercise per session, and then gradually progressing to those 3 sets of 8 to 10 reps. And then type, accessibly resistance, using machines that are convenient and also safe. If they're not available, use dumbbells, cuff weights, and or elastic bands. And then for flexibility, the frequency, having them do it daily, especially in the presence of joints contracture, again, that spasticity or that frequent wheelchair propulsion and manual transfers. Intensity, not allowing that stretch of a discomfort, being a higher scale, or having the scale be higher than a 2 on that 0 to 10 pain scale. And then time, stretching each muscle group repeatedly for 3 to 4 minutes a day, preferably after a warm-up or following a training session and or competition. And then the type, active stretching is preferred, but this is not possible, or if this is not possible, low intensity passive stretching may be used by the individual and or the assistant. And then exercise test or training. exercise training. Include resistance exercises for all of those major muscle groups involving the upper body, the arms, the trunk, and also those lower leg muscles. And really try to resist the overemphasis of those upper body pushing exercises and balancing those pushing exercises with pulling exercises in order to work posterior side as well. When progressing to advanced exercises, this may include ballistic medicine ball exercises or even possibly battle rope training. All those muscles should be slowly stretched again in order to minimize the election of the stretch reflex, emphasizing those prime mover muscles of the chest and the shoulders. And then again, the progression should be slow and based on their pain tolerance. And then some special considerations with these fellers. Participants should empty their bowels and bladder before beginning their exercise. Skin pressure, ulcers should also be avoided at all costs, along with being checked daily. Those with SCIs will probably experience muscular fatigue before substantial central cardiovascular stimuluses are actually achieved. Those who have a recent no standing history also may be at increased risk for fast fractures. Strength training sessions from a seated position in a wheelchair should also be completed with non-wheelchair exercise bouts. And then individuals with SCIs should also tend to endure higher core temperatures. Also tend to endure higher core temperatures during endurance exercise. So otherwise, that's all I got. Thank you guys for your time.